Good evening. I'm Gene Ransom. I'm the CEO of MedChi, and welcome to another in a series of MedChi and CRISP EQUIP education seminars. I want to give a special thanks to the Maryland Society of Orthopedics, or I guess actually they're the Maryland Orthopaedic Association. Audrey, who's their executive director, and Dr. Pushkin, who's their president, were very helpful in getting this set up. So tonight you got quite a treat because you have the whole CRISP team here and part of the MedChi team to explain the opportunity with the episode quality improvement program. And we've added a bunch of bundles this year to the orthopedic suite. So it is perfect timing because we have a good 30 days left to sign up. And it's really the opportunity for you, whether you work in private practice or for an employed physician, employed practice of some type as a physician or another practitioner. It's the perfect time to look at this and see what is your hospital doing, what is your employer doing, or what are you doing if you're in private practice. I'm going to introduce the team who's here tonight. We have Olivia Simon, who is going to be the quarterback and kind of taking charge of the presentation tonight. And then we're going to hear from Crystal with CRISP and Kim Dixon from CRISP, who are part of the utility that runs all the collection of data and the sign up for EQIP. CRISP is one of the key partners in the state of Maryland doing so much. And one of the things they do is they help operate and run EQIP. And last but not least, we have one of your own, Dr. Mike Grunner, who is a orthopedic surgeon from Montgomery County, Maryland, who really has been key in helping us. In fact, he really solely helped design the MSK episode that we added last year to the EQIP suite. So you could not have a better clinician to talk. So given that panel, I'm going to stop talking and turn it over to Olivia and just thank MOA one more time for helping us set this up tonight. Olivia, it's all yours.
Thanks, Gene, and thanks everyone for joining us tonight. I'm glad you were able to be here with us. So we're going to just jump right into things and start with what is Maryland's Episode Quality Improvement Program, or EQIP. So the Episode Quality Improvement Program is a voluntary advanced alternative payment model that engages practitioners who treat Maryland Medicare beneficiaries in care transformation and value-based payment through an episode-based approach. So what this means is by participating in EQIP, participants will be held accountable for achieving both cost and quality targets for one or more clinical episodes. And EQIP participants will have an opportunity to earn a portion of the savings that they are able to create or generate within their selected clinical episodes as a lump sum incentive payment. So let's break it down a little bit further to understand how this program operates. So I've divided it up into three main sections. So we're going to start off on the left with the annual enrollment opportunity. So this is where we are right now. And during this annual enrollment opportunity, practitioners can enroll in EQIP and select the clinical episodes that they are eligible for. And these episodes will trigger through the submission of qualifying billing codes, such as ICD-10 codes or CPT codes. Then we have this target price that is assigned a unique target price per episode that each EQIP entity selects. And this is done by using costs from those episodes in the baseline year. So for all of the orthopedic episodes, EQIP will use calendar year 2019 as the baseline period. And then the final element of this program is to assess the performance. So the episode performance year cost will be compared again to that unique target price that was assigned to the entity. And if those episode costs are less than the target price and savings were achieved, then there will be some quality adjustments and a shared savings amount will be due to the EQIP entity as an incentive payment. So there's one thing I really want to emphasize with EQIP is EQIP uses claims data to assess both the cost and the quality performance of the entity. There are no additional reporting requirements for participants. So for performance year 5 or calendar year 2026, we have 24 specific orthopedic episodes that are being offered. You'll see them all listed here on the screen. And again, in order to select an episode, you will need to meet the minimum volume requirements to do so. And you can determine your eligibility by reaching out to the EQIP team. We'll talk next steps at the end of this slide deck. But these are the 24 specific orthopedic episodes that will be offered for 2026. So now I'm going to turn it over to Dr. Gruner, who's going to dig a little bit deeper into 3 specific episodes and talk about how those episodes look and will operate under EQIP. So Dr. Gruner, it's all yours.
Thanks, Olivia. Olivia has been instrumental to trying to making this program a success, and I want to just thank her for putting all of these slides together. I work at Ortho Bethesda. It's a large orthopedic group in Bethesda, Maryland, and our group has been very successful with these specialty value-based care models, and I'll just highlight a few of them and explain how they work. So to the left here, you'll see that there are trigger codes. So essentially what happens is there is a CPT code for a knee replacement, and an ICD-10 code that is associated with that. And what happens is once a CPT code and an ICD-10 code are assigned, for example, knee osteoarthritis with a knee replacement procedure, then a trigger event happens. And once a trigger event happens, 30 days before and 90 days after, all the costs for that care is attributed in a 90-day episode. So for example, if the total 90-day total cost of care, including hospital stay or an ambulatory surgical stay, the physical therapy or post-acute care afterwards, or any complications that happen, all of that's aggregated into one price. So for example, the way it works is you beat your benchmark. So if your benchmark was $25,000 in 2019, and as an aggregate in a group, you had $2.5 million of cost, and you came in at an episode cost at $2 million, then you would see $500,000 in savings. It's a little bit more complicated than that because you get a portion of those savings, and then also there's a quality score. But for the most part, the group, which is called an EQIP entity, which can be made up of any type of doctors, doesn't have to be a designated organization based off their TIN, would see the savings, and they would see that 18 months after the start of an episode. So if the episode started in 2026, there'd be a year and 9 months of claims run out, and they would get it in the fall of the following year. Next slide, please. So when EQIP first came out, it was mostly procedural-based episodes, which if anyone has participated with those episodes in the past through BPCI, those were procedural-based episodes that really focused on the 90-day period. Well, through an episode grouper that we use with in conjunction with the state of Maryland called PACES, we're able to really not only have procedural-based episodes, but also condition-based episodes. So one example of our condition-based episodes is low back pain. As opposed to the trigger event happening on a procedure event, now the episode starts at the beginning of a physician's office visit. And if there's 2 visits in that period, then a trigger event or episode trigger occurs with a ICD-10 code of low back pain. And then they look at all the costs 30 days prior, and for this episode, it's a year afterwards. And if the target price was $1,000, and as a group, you saw 50 patients with low back pain, and you came in at episode cost savings of $47,000 compared to the benchmark year, then you would see a savings of $3,000. And this is an example of a condition-based episode. Next slide. The third one is even going more downstream. So before we were just looking at optimizing the procedure, then we were looking optimizing the low back pain physician visit. Now we're trying to look at optimizing all of musculoskeletal care. And so this starts at a physical therapy evaluation. And essentially there are three codes, low, moderate, and high complexity for physical therapy. And then we've included all the MSK ICD-10 code claims data set. And this episode looks at total MSK claims costs. Your therapist can be included in this episode. And if the target price was 600,000, you come in at an episode cost of 520,000, you would see savings of 80,000. And unlike the year episode, which can be a long time for managing low back pain, this is looking at a 6-month episode from the initial physical therapy evaluation. Next slide. So I showed you those savings. You don't get 100% of those savings, but you can get a majority of those savings. If you are a low-cost provider, and this is all done by the state, you can get up to 80% of the savings. And if you're a high-cost provider, you can get up to 50% of the savings. There are 3 quality measure scores. Those scores are done by mostly primary care doctors, but also our group has optimized for those at the procedure time when a lot of these things have been discussed. And the 3 quality measures include advanced care plan, documentation of current medications, and body mass index. And so it doesn't matter if you're a primary care doc, an endocrinologist, a cardiologist, or an orthopedic surgeon. These are the same 3 quality measures. And this makes up 5% of the clinical quality score for participating. Next slide. So this program has been wildly successful. We're in the heading into the 5th year, but the first 2 years we have shown the most recent year, which we have reporting, we have had $36.7 million worth of savings. And orthopedics has been one of the most successful specialties, seeing about 56% of the total shared savings over those 2 years. Next slide. So, I really encourage people to participate. I think it's easy to do. The signing up is pretty easy. We've talked about that. I'll just tell you and highlight what some groups have done to really show millions of dollars in their pocketbook of savings. And these are just some of the examples of care transformation that is happening. So, shifting your care from a hospital to an ASC is a large, and if it's clinically appropriate, savings have been seen there. Care transformation, specifically in care management, really looking at the people that are high risk that you're doing surgeries on, or high risk that you're trying to manage a condition like low back pain and avoiding unnecessary ED admissions. Really thinking about care protocols. One of the ones that we've discussed and is optimizing care with the call center and making sure that if people are high suspicion of a blood clot, they go to a outpatient vein center versus the emergency room. Post-acute optimization, so sending patients not just to skilled nursing facilities, but thinking about outpatient physical therapy and maybe considering home PT. Hold on. Hey, I'm on the call. Sorry, my daughter came on the call. Can't prepare for that one. Surgical appropriateness. And then obviously what's been very successful for our practice is condition-based cost management for low back pain and osteoarthritis. Really providing evidence-based management of these conditions can be really lucrative and great opportunity for people to think about care transformation. I think one of the things that CRISP and and the state of Maryland is focused on is providing performance data. So you can really look at who's high cost, low cost in your group. And I think these are just some of the successful strategies that can help you be successful in participating in this program.
Thank you so much, Dr. Grinner. So now I just want to touch on this sounds great, right? But what if I don't generate savings? So the really nice thing about EQIP is the risk is taken at the state level, not the individual practitioner level. So what that means is EQIP entities are not expected to repay CMS as a result of inadequate performance. However, there is a DIS savings policy that exists to ensure EQIP drives meaningful improvements in cost efficiency and quality. So I want to highlight the two elements within this DIS savings policy. The first being this annual accountability. This policy states that prior to earning an incentive payment, EQIP entities are required to offset any cumulative DIS savings from a prior performance year. And then the removal accountability says that if an EQIP entity generates DIS savings in 2 consecutive program years and is in those lower 2 terciles of that tiered shared savings rate, they would have to sit out of EQIP for at least 1 year before being able to re-enroll. So now let's kind of recap the benefits. Why should you consider signing up for EQIP? So first of all, as I mentioned earlier, EQIP is an advanced alternative payment model. This means that practitioners who enroll in EQIP will be considered qualifying APM participants or QPs. QPs will receive a MIPS exemption. They will be exempt from both MIPS reporting and all MIPS payment adjustments, and they will receive a qualifying APM conversion factor update as set by Congress. This is currently set as a 0.75% APM conversion factor. So again, this is just by enrolling in the program. You get the exemption and this APM conversion factor update. In addition, there's the opportunity for a lump sum incentive payment. So as we discussed, if entities are successful at generating savings within their selected clinical episodes, they can get a portion of those savings as a lump sum incentive payment. Another benefit to this program is EQIP is all claims-based reporting. So EQIP is strictly using claims data to assess both the cost savings and the quality measures associated with this program, and there are no additional reporting requirements for participants. And lastly, as we just mentioned, there is no risk at the practitioner level. You will not owe CMS money as a result of inadequate performance. The risk in this program is at the state level. So now I'm going to turn it over to Crystal from CRISP just to go over next steps if you are interested in learning more or interested in learning about the enrollment opportunity.
Hi, everyone. So thank you to Dr. Grinner and to Olivia for just giving us that wonderful presentation on the EQIP program. So if you are looking to enroll or interested or have any further questions, you can always email us at the EQIP inbox, which is equip@crisphealth.org. If you are brand new, you've never used CRISP before, this is your first time enrolling in EQIP, we do ask that you reach out to us prior to August 20th. Although the enrollment period does officially close on the 29th, we want to make sure that there's enough time to answer all your questions, get all your access set up so that you can have a smooth enrollment process. And so if you are currently working at a hospital or hospital employed, we do recommend that you reach out to your department chair, your quality office to confirm your participation in EQIP and just learn how you can take advantage of the opportunities that it offers. And if you do have any other questions, we do have a website, and that I think Olivia has linked here. And this is our CRISP learning system. So it goes over all of our different care redesign programs that we support at CRISP, and EQIP is obviously one of them. And Olivia and I recently just worked on creating an EQIP curriculum. So if you want to learn more about EQIP and the ins and outs of it, you can find the EQIP curriculum on our website, as well as other learning videos and documentation and all the ins and outs of the program. So if you do have questions, a quick question, feel free to email us. And yeah, if you're looking to enroll, also feel free to email us as well.
Thanks, Crystal. So we're just going to move into the Q&A session now. If anyone has any questions about anything that we discussed, enrollment or next steps, please feel free to type in the chat or unmute yourself.
You guys were so clear. There are no questions.
Apparently so. This is
All right.
good.
Well, if you don't have any questions now, but again, if you think of any questions or just want more information or next steps, please reach out to the EQIP inbox at equip@cristhealth.org.
And you can always reach out to Olivia or I directly. It's never a big deal.
Yes.
If you have other billing, contracting, other kinds of questions like that, we're happy to help you out, which are less about the entity. I would strongly urge, if this is something you have not done, that you at least send your NPIs in to CRISP to get the opportunity run to see what you could be eligible for, because you might be surprised. So.
Yeah, that's a great opportunity. And thank you for bringing that up, Jean, to just kind of see what could possibly work for the groups that you want to enroll in, the NPIs that you plan to participate with. We definitely recommend, especially for new individuals or new entities, to try to get those NPIs run just to see what opportunity EQIP can provide for you and your group.
All right. Well, thank you, everybody. Enjoy the rest of your evening.
Thanks, everyone.
Awesome.
Thank
Thanks.
you.